Okay, this is my audience.
Hi everyone, my name is Charlie Rogers. I'm a nursing student here at Aiken Tech going into my third semester in nursing school. We're encouraged to spend at least 1 year working on a medical surgical floor to get our foot in the door with our career. At least 50% of nurses working in med-surg for the first few years. However, my goal is to start in a mental health or psychiatric setting because it's what I'm most passionate about. Psychiatric nursing is a branch of nursing that helps you develop stronger empathy skills, allows you to get to know and provide care to patients who come from all different backgrounds, as well as improving your nursing skills, specifically in psychological conditions. The benefits of psychiatric nursing are endless, but first I want to dive deeper into developing stronger empathy skills. When caring for patients with psychiatric needs, you really have to try to understand their thought process and the way they feel, even when it comes to stuff you wouldn't typically consider. Take, for example, a nurse is caring for a patient with schizophrenia. Although the nurse does not experience hallucinations or delusions, they must take time to put themselves in the shoes of their patient, thus increasing their awareness and ability to consider the emotions of another person, as opposed to being task-oriented or going through a checklist when providing care. Along with this, mental health nursing is less about physical symptoms than a typical bedside nursing job, and more based on the patient's feelings and experiences. Nurses in this field must actively listen to their patients' thoughts, feelings, and beliefs to provide adequate care. According to a study done by the International Journal of Mental Health Nursing, mental health professionals, specifically nurses, score higher on a test of EQ, which in simple terms is their emotional intelligence, than the control group they use that do not work in mental health care settings. Moving forward, but staying in the same realm, nurses working in the mental health field care for patients from all different lifestyles. Working as a nurse in mental health, you get to experience working with different races, ages, and genders, which can all affect their outlook on life. The CDC provides us data that the age group most likely to reach out for psychiatric help is young adults 18 to 24. When considering patients come from all different lifestyles, you may forget that lifestyles vary by generation. A person this age is most likely very involved with social media, which can greatly affect mental health. Along with age, women are also more likely to reach out for help. Women have completely different experiences in life, the biggest difference being pregnancy, specifically postpartum. Substance abuse is also a very common reason to seek psychiatric help. This can give people a very different outlook on life than someone who has never struggled with addiction. This ties back to the idea that mental health nurses have to put in extra effort to really understand the thought process of their patients to provide the best care possible. To continue, aside from the emotional ties in mental health nursing, this field also greatly improves your clinical skill and knowledge in less taught aspects like psychological disorders. Mental health nurses are also highly skilled in psychological disorders because it's the main healthcare branch they focus on. This increases their clinical skills and knowledge in this specific realm. One of the points we've hit on the hardest during my nursing school journey is therapeutic communication. In layman's terms, this is essentially the old saying, it's not what you say, it's how you say it. You have the greatest opportunity to improve this skill working with psychiatric patients because the way you treat them matters most. Aside from the words a patient uses, these nurses are also skilled in noticing body language habits that can differ from what the patient tells you verbally. This concept also ties into de-escalation tactics, being able to recognize when a patient with a condition may become combative or stressed, recognizing triggers as simple as the way you may have asked them to take their medication, and the ability to stop conflict before it even occurs. As you further your career in psychiatric nursing, you have a better concept of the different diagnoses you may encounter, things that may not be plainly written in a textbook, and understand the nuance of their condition. After going into detail on these aspects of mental health nursing, I hope you have more knowledge of this field than before. To conclude, mental health nursing gives you more opportunities for personal and professional growth. It allows you to develop stronger empathy skills, interact with people from all backgrounds, races, and ages, as well as improves your overall nursing skills. Truthfully, I believe nursing is one of the most diverse career options there is, and it doesn't matter what branch you decide to work in, you will find things you love. After this speech, I hope I have given you more insight on what being a mental health nurse consists of.
And here's my audience.